Dengue cases are on the rise again in South Asia, with infections surging during the monsoon season. Now, what used to be a viral disease limited to the monsoon months has now become a year-round problem. Some experts warn it could become a global pandemic threat. Neha Poonia takes a look at what's making South Asia, especially India's dengue outbreaks, more frequent and more deadly.
An open drain runs right along this Delhi neighborhood. It doesn't just hold garbage and sewage, but something far more dangerous. Its still waters are the perfect breeding ground for the Aedes aegypti mosquito, tiny carrier of the dengue virus. Bimla says because of the mosquitoes, someone is always ill in her family of 11, and they've all had dengue at some point in the last few years. Her granddaughter even caught it in February, when it should technically be too cold for the mosquito to breed. And last year her daughter-in-law got dengue and has still not recovered.
डेंगू हुआ जब से उसको ये पोती का हाल हो रहा है मेरी का बहुत कमजोरी आ गई इन घुटनों में से चला नहीं जाता माँ बेटियों से बहुत परेशानी हो गई खिचड़ गई थी बिल्कुल बहुत समय लगा सर 6-7 महीने से भी ज़्यादा लग गए थे
Dengue has no known cure or treatment. It is also called breakbone fever because of the severe muscle and joint pains that occur during infection, as well as high fever.
It's like a tsunami coming, a big tsunami coming and going off. What happens during that? It destroys your organs.
Dengue cases in India have been steadily rising since 2020, reaching what some call epidemic levels. Last year, the country recorded nearly 290,000 cases, 50,000 more than the year before. And in the first 6 months of this year, the total tally has already surpassed 32,000, nearly double of what was reported in the same period last year.
Eradication of dengue means, first of all, we have to eradicate the mosquito. We have to keep our surrounding clean. Source has to be controlled.
In some parts of the capital, New Delhi, anti-dengue drives have begun. Officials are spraying insecticides into open drains to kill mosquito larvae, using a dense white fog of chemicals to fumigate mosquito breeding hotspots. They're also trying to spread awareness among residents with the message, cover it up.
ज़्यादा कॉमन तो ये वाटर स्टोरेज का प्रॉब्लम है। दिल्ली में कई जगह पानी की समस्या है, जहाँ पर लोग एक घरों में 10 से 12 कंटेनर रखते हैं। अवेयरनेस के कारण काफ़ी जगह प्रैक्टिस में आ गया है कि लोग कंटेनर ढक के रखें, पर अभी भी बहुत प्रॉब्लम्स हैं, लोग कंटेनर को ढक के नहीं रखते हैं। मेन इस बीमारी का होता है कि मच्छर से फैलती है। अगर हमने प्रॉपर मेजर्स नहीं लिए, कॉजेज़ हमें नहीं पता चला, तो क्लस्टरिंग ऑफ डिसीजेज हो जाती है।
During South Asia's monsoon season, the tropical weather and widespread waterlogging give the Aedes mosquito perfect conditions to thrive. Not just in India, but in Nepal, Bangladesh, Sri Lanka, dengue cases are now being reported throughout the year in far higher numbers. Experts say global warming, which has led to an extended monsoon season and higher humidity levels, is to blame. Some experts also point to rapid, unchecked urbanization in South Asia, where thousands live in densely populated enclaves without proper water supply, sanitation, or waste management systems, and where stagnant water often collects in the streets.
Make sure that there is piped water so that people don't have to store water in cans and jars, number one. And number two is areas which are prone to waterlogging, those could be addressed, even through maintenance.
But those are long-term measures, Bimla says, that don't immediately solve the problems she and her neighbors face. They want officials to ensure the drains are covered and anti-dengue measures are taken throughout the year and not just when cases rise. Neha Poonia, CNA, New Delhi.